We are talking about issues of politics, culture, and reproductive justice in real time in the ways that we do it best. We are including communities that are often underrepresented. We are engaging and asking the critical questions about if, when, how, and why it's important to talk about the issues that matter and include Black women in that conversation.
Here, we lack policies that make it less stressful and less costly to combine paid work with child rearing. We are facing a profound care work deficit. Right now, what we lack is the moral will to invest in caregiving. And I would argue that by engaging a critical mass of young adults in caregiving early in their careers, we would elevate the value of care work. Future doctors, future teachers, future administrators, future legislators would have first-hand understanding of the value of care work, and that would impact policymaking going forward.
Leading for equity means we have to shut down those tapes in our head that give us all the reasons why we can't do it. We couldn't possibly lead for equity.
And yet, when we lead together as women, we get huge benefits and powerful success.
Maybe you've got some of these reasons. Maybe you've been told that it's impolite to talk about race in public, or that if you're the one who brings up race, then you're actually the racist. So let's steer clear of that.
So if I were to ask you to plot a run through your community, how would you do it? Think about it. Think about your neighborhood. Think about the map you'd see in your head. Think about how you'd prepare. Would you take a cell phone, mace? Would you run alone? Would you run in the dark? Would you always take a friend? Running reveals how we internalize our geography. It maps what surrounds us, and it maps who we are.
Him like himself a child and child. Grandma likes the sweet family secrets under the rug. Go give your uncle a hug, obeying Nanny.
And since this is what's happening, we have to be ready to help people navigate and understand the different levels of intimacy. Intimacy looks different between you and your students, your spouse, your lover, your friends, and even acquaintances. And so with these different types of relationships, there are different levels of intimacy that has to be navigated and explained.
We have models that we can use that show us that, yes, leveraging the technology in our cell phone can help improve our health.
And I stand before you as an artivist, and I ask you, what if we reimagined?
What if we viewed sexual health in context?
Child and maternal health through the reproductive justice lens. And what if we saw artists as the experts at helping us to develop strategies to address child and maternal health?
We talk to these women, what we hear from them, it is precisely that shared leadership that they credit with their success. We've heard over and over from women that without joining forces with other women, they couldn't lead the life that they want to lead. They couldn't do work in the way that they want to work. So Betsy and I, we're on a mission. We're on a mission to spread the word about these role models.